to me, the big challenges and the big opportunities are in figuring out what works and diffusing it broadly. There's a lot of incredible medical technologies and procedures out there that really can improve health, and some of them at relatively low cost. And figuring out what those are and how to diffuse them broadly, how to bridge average practice with best practice, I think we can achieve large health gains that way. The flip side of that is figuring out what doesn't work and limiting the diffusion of that type of technology or those types of procedure.
I think some of the biggest opportunities are actually outside of healthcare to some extent. So we know that social factors, things like poverty, educational attainment, all of these social factors have a profound influence on people's health, but we still don't know a lot about exactly how altering income supports, for example, in social welfare policies or even educational policies could ultimately improve health outcomes for people.
So one area I've worked in healthcare where I think there are a lot of opportunities is in the role of social networks in health. We're just learning how to measure health and other sorts of outcomes within social networks and to figure out how social influence works within social networks. But there are a lot of opportunities for improving health through social networks and social media that I think both scholars and the foundation will be able to take advantage of.
The access to health insurance is expanding, which means we're getting the care, and so now our remaining work, or an increasing portion of our remaining work, is going to have to be focused on what kind of care people are getting with that insurance.
I also think some of the best opportunities for enhancing health and healthcare, and I'm a political scientist and I'm a believer in public policy, come through government officials, folks who are dedicated and believe in the possibility of government not controlling centralized healthcare systems, but in making contributions in a collective spirit to our shared health challenges.
Figuring out what the right way is for Medicare to pay providers. So that's key both to solving the fiscal problem that Medicare faces and also to figuring out how to get better quality care delivered to beneficiaries. So solving those two problems, figuring out how you write a contract with providers that delivers value, I think that's a central problem that economists can contribute to.
I think the Affordable Care Act offers incredible opportunities, but getting the law passed was really only the beginning, and I think sociologists appreciate that implementation is everything. So how the law actually gets implemented on the ground in different states, in different cities, towns, hospitals, clinics, for different kinds of patients, those are core sociological questions, and I think we're not going to know the answer for some time.